I think the role for interferon in accelerated or blast phase disease is somewhat limited, but in some ways, the best way to treat accelerated and blast phase MPNs is to never let someone's MPN progress to that state. So really, when thinking about accelerated and blast phase disease, treatment is important, but prevention is probably even more important. So identifying those high risk chronic phase MPNs and seeing what can be done to ultimately intervene on the natural history of disease, the natural course. One of the very intriguing things about interferon is that there's so much data to support that there is a strong anticlonal effect, meaning patients with polycythemia vera or central thrombocythemia that receive interferon-based therapies, if you check for their driver mutation, whether it be JAK2 or CALR or MPL, you can find that for a subset of patients, that mutation burden goes down significantly, may become even undetectable. And we're now getting more and more data to suggest that when you eradicate the driver mutation or drive down the driver mutation, you may actually be able to delay or halt progression of disease. So I think while interferon may not have a specific role in accelerated or blast phase MPNs, I think interferon and other anticlonal therapies in PV or ET or kind of the chronic phase of MPNs are certainly a very intriguing option because they may be able to prevent or delay progression to accelerated or blast phase disease.